Hello, this is Eva Sheppa, host with From Help to Care, sponsored by Family Health Center of Marshfield. I'm joined today by Dr. Xin Ruppel, Director of Pharmacy Services for Family Health Center. Welcome, Xin.
Thank you. Thanks for having me.
Would you like to give a little introduction of yourself so we can get to know our resident pharmacist today?
Yes, I would be happy to. My name is Xin, as you know, and I have been with the Family Health Center program for the past 17 years. I'm a practicing pharmacist. I've served in various roles within the program, Special Projects Coordinator, Assistant Manager, and now I am the Director of Pharmacy. So I oversee our team of 13 pharmacists, pharmacy technicians, and assistants, and we provide access and pharmaceutical care for patients across a 10,000 square mile coverage area.
Wow.
Across north central Wisconsin. Yes, definitely wide reach. Really enjoyed my time so far at FHC and really committed to helping patients with our team and our dedication to the FHC mission. Personally, I got my pharmacy degree and my MBA at Drake University in Iowa. And after graduation, I found Marshfield by way of residency. So I completed my postgraduate year one residency here at Marshfield Clinic. And since then, I have gained board certification in pharmacotherapy, ambulatory care. And as I mentioned, I really, truly enjoy helping patients understand and get the most out of their medications.
Sure. You mentioned 10,000 square mile reach. How do you accomplish that?
Yeah, great question. So right now what we do is utilize and partner with the United States Postal Service to send medications via the mail to our patients.
Wow.
And as you all may know, mail has its ups and downs, but what's been really nice is reaching out to some of our rural patients that reside in what we call pharmacy deserts, where it's at least an hour drive, perhaps to the nearest pharmacy.
Wow.
We are able to get their medications delivered to them at the door.
How many prescriptions do you mail out in a month?
Right now, I think we're averaging about 3,000 prescriptions, or packages, I should say, but sometimes packages contain multiple prescriptions. And we also mail out refrigerated products. We mail out specialty medications. So there's a wide array of products that we're mailing.
Great. Another service provided by Family Health Center that people are unaware of. So I'm glad you had a chance to share some of that with us.
Absolutely, and we're hoping as we expand our service lines that we reach more patients and open our pharmacy services to even more patients locally and within that larger 10,000 square mile radius.
Yeah, great. Well, stay tuned for the future of those expansion of services.
Absolutely.
But today we want to talk a little bit more about understanding your medications. Medications, we can't get away from them. They're on TV, commercials, we go to the doctor, we're prescribed a medication, we go to the grocery store, sometimes even the gas station, and there are medications everywhere. And understanding all of that and how they work together or don't work together is pretty important.
Absolutely.
Yeah.
So what I would like to do is share some hopefully helpful tips and kind of basic strategies to help everyone understand and get the most out of their medications. There's some, I think, basic things that we can do that apply to any medication that you might be getting prescribed. And believe it or not, the understanding about medication part starts before the prescription's even issued. So I think a lot of people don't realize too that the questions that you should be asking should really begin during that doctor's visit, perhaps when you're getting prescribed the medication. And I hear this from both sides, from patients and providers as well. We know that time is of the essence in these visits. It's a very short amount of time to get a lot accomplished. So there are 3 or 4 key questions that I think patients should be asking if their provider is not already discussing when we're talking about medications. I think the first one sounds very basic, but is, what is this medication for? That you should always know why you're getting prescribed a medication, and believe it or not, sometimes in the rush of things, or if a provider is explaining something and you're not understanding, remember, it's always a partnership. There should be an ongoing conversation, so feel free to ask if you're not understanding. You know, a lot of times we as healthcare providers are entrenched and we are so used to what we say every single day, right? And it's a lot of medical terms and big words, and so if you're not understanding, please take the time and ask the provider at the time, okay, so why am I getting this medication again? Can you help me understand? The second question I think we should ask too is this the best medication for me? So let's take diabetes, for example. There are a number of medications in the market right now, and based on what you want to get out of your medications, whether it's lowering your blood pressure, continue with the diabetes example, but lowering your blood pressure or losing weight perhaps, or better controlling your cholesterol or controlling your heart disease risks, for example, there might be better or different medications that would be more suited for your goals. So that's a good part to have a discussion with your doctor about. And then the last two kind of tie in together is more of a timeline. So one is, when should I expect to see effects from this medication? When will I start to feel better or, you know, see better? And then the kind of extension of that is, how long should I be on this medication? There are certain medications where the doctor will be, you know, asking you to take just for a short period of time and a definitive timeline, like antibiotics, for example. A lot of times it's a week or 2 weeks to take and then you stop. Versus something that we use for chronic disease, you may be on that for a much longer period, months, possibly years. The reason for that last question is also to check in with the doctor on when they expect to see you again as a follow-up. A lot of medications when you're starting require lab work as a follow-up to make sure your kidneys, your liver, everything is processing all right, and that to make sure that you are hitting those clinical goals like blood sugar control, for example, that the medication is working the way it's supposed to and not causing you harm. So that last question also ties into when the provider would like to see you for follow-up, or at least check lab work for your blood work to make sure everything's going well.
Yeah. You raised some good points. Time is of the essence when you're in the provider office, and often you get the prescription written, out the door you go, you drive to your pharmacy, you pick up the bag with the 6 pages of information, which is wonderful and important information, but it does not answer what you're suggesting here. What is the best medication for me? That's not going to be in that packet. When should I expect to see results or effects of the medication? Also likely not on those 6 pages that we usually put in the recycle bin. And then finally, how long should I take the medication? Again, information, or when should I return for blood work? None of that is on that paperwork. And so I think what you're talking about really is something to think about when we're in the provider office, and to advocate for ourselves and really have that provider answer what's on our minds.
Absolutely. And providers, you know, treat these visits, I think, also as a partnership, right? They're reacting to the information that you're presenting. And so I know providers love to know what the patient's priorities are and what they're looking to get out of. And if you don't know, that's okay too, but I think that's important to communicate to the provider, right? And similarly, we talk about, at least for myself, sometimes when you go to the doctor, it feels like you're taking a test, right? You take your lab draw and then they see the results and they say, oh, that's good, or no, that's not good. And you feel like you're passing or not passing a certain class, but really they're reacting to the information that's specific to you. So similarly, if you have questions or concerns about medication, or for example, if you're not taking a medication as prescribed, it's important to let the doctor know so they can adjust kind of the care plan with you accordingly.
that kind of gets into the medication lists and how we convey that information to our providers and making sure that it's accurate and that it's important that it's accurate. Can you talk a little bit about some of that?
Absolutely. So I think what I'll share too applies both to the provider visits and also to what you tell your pharmacist when you present at the pharmacy. Unfortunately, in our general healthcare realm, a lot of systems are separate, and for the most part, you know, a general large retail chain may have what we call dispensing or pharmacy records that are not always tied to the medical records.
And we think everything's tied together.
Correct. In an ideal world, it should be.
Yeah.
It should be. So when you have a lot of questions that might be the same from different sources, please be patient, and you know, it's important for you to keep an accurate record, but also to share that accurate record with your provider and with your pharmacist. So I always tell my patients that you are the expert on your body. You know, when you're experiencing certain side effects, or if you are not seeing certain results, you know, that you're the best source of truth. And what we need to do as your health provider team is to support you that and provide you a care plan that can get you to where you need to go. And so medication listing and keeping a very accurate medication list of not just what you're supposed to be taking, but what you're actually taking, is very helpful. So we have a number of these, what we call interventions at the pharmacy when, say for example, a patient gets issued a new blood pressure medication and or their dose is doubled or increased. When we talk to the patient reports, oh, I haven't taken it for 6 months. And so here you see the discrepancy where the provider thinks it's not working, but in actuality, they were not taking the medication. And so medications, even though they're very small, they're very powerful.
Yeah, I was going to ask if that's dangerous.
Yes, and so in that patient's case, what the patient might experience if they end up taking the double dose of the intended medication is their blood pressure can drop. They can be prone to, falls or other accidents. And, it can affect their kidneys. It can affect their liver in processing and clearing the medication. So we definitely treat those cases very seriously. And certain medications can have very rare but serious side effects that, again, we want to make sure patients are informed when they choose to take it. But the discrepancy in dosing, for example, would put them at risk for a side effect that was totally avoidable.
Right, right. So again, just illustrating the importance of being an active participant in your health care and seeming that you're repeating things over and over to different care providers, but it's important to make sure everybody is crystal clear what you're taking for medication.
Absolutely. And you don't have to do this alone. And so again, I mentioned we're your healthcare partners, your provider's office or your pharmacy. For example, our pharmacy we generate medication lists and charts for patients to outline based on what we know what patients are taking. And so we take everything that we dispense for a patient, for example, print it out and put the different times that they're taking doses. And it makes a really nice chart to keep organized on when you have to take certain medications, but that also serves as a great record for when you go into the doctor's office, or say you have an emergency, you go into the urgent care or emergency room, not within our community. Having that list could be life-saving in terms of avoiding side effects or having that other healthcare facility understand what current medications you're on. So.
I think something like that also would be important in case you need to have somebody take care of you, a family member or a friend. You're under the weather, you can't get up and manage your pill box and be able to set it up. And you put all the pills you ever got in the bottles. They're all on the kitchen table together. Some you take now, some you took 3 years ago. It's still on your kitchen table. And your care provider is trying to figure out whether this little pill is the same as the other white pill in the bottle or not.
Absolutely. There's so many points that I think I could expand upon. One is the pill storage and keeping on the kitchen table, and certainly anything that you're not currently taking. So Annually, there's actually a drug disposal day, and the DA hosts that, where we collect medications to be disposed of appropriately. We certainly don't want old and used medications end up in our landfills and our water wasteways. However, I think as a general practice, it's good to just remove medications that you're not taking regularly from wherever you keep your medications, because they can be intermingled. You might accidentally take the wrong one, and medications do expire. And so you don't want to take something that may not be effective, or even worse, cause you problems.
I think some people, though, this is expensive.
Yes.
I might need it again. I might need it later.
Yes.
My neighbor might need it. And you kind of hang on to that stuff.
Yep. And if I can't convince you to dispose of it, at a minimum, I would say definitely remove it from the general inventory. And with medication storage, particularly if you're on controlled substances, and many of those, like what you consider maybe pain medications or certain muscle relaxers, you do want to store those in a very secure location. And even if you don't have other people living with you, perhaps you might have visitors. We particularly counsel grandparents, for example, who may have grandchildren over, that if unfortunately there have been accidental deaths of children who have gotten into grandparents' medication supply, or accidentally had a opioid patch stuck to them and the medications leaked into their skin. And so we do caution patients that if possible, put their medications in a dry, cool place, preferably. Ironically, even though it's called the medicine cabinet, not in the medicine cabinet in the bathroom because of all the humidity that bathrooms generate, but maybe in a cupboard or behind locks if you do have controlled substances.
Well, medications can be pretty complicated, from asking questions when you're in the office, why am I taking this? Is this the best medicine for me? These are some really great questions to ask, but then you go to the pharmacy and there'll be more questions about your medications. Then I take my medications home and, okay, I'm not taking this, now where do I put it? And am I storing my medication in the right place and putting it away when I have guests or visitors or children in my home? There's a lot to managing all of this.
There is. It can be very overwhelming, and we acknowledge that, and we know it's not simple. Most chronic diseases have at least 2 or 3 medications. In the case of diabetes, it's not uncommon to see patients with 3 or 4, and then when you add in testing supplies or other glucose monitoring devices, for example, you might be having 5 or 6 different prescriptions to manage, refilling at different times. And so we, within the pharmacy practice, we definitely appreciate that it's a lot to keep track of, and we try and make it easy for the patients as much as we can. When I mention about the limited time that you may have with your provider to discuss questions, what I would love for patients and community members to keep in mind is the pharmacy is a great resource. It's a very accessible resource, yes. And pharmacy team members are medication experts. And I say team members because in addition to the pharmacists, we also have technicians who are very knowledgeable about insurances and coordinating coverage for those medications that you may be getting. And we also have assistants that help us, process through and pack, for example, in our case, pack and mail your prescriptions. And every single step of that process is important, right? Everyone plays a role in making sure that you're getting your medication in a safe and appropriate manner. But specifically to the pharmacist, when you go to the counter and the pharmacist generally asks, what questions do you have? That's a great opportunity. I know most people just want to, take out their, check out their milk and take their groceries home. And, you might be at the end of a very long day anyway and don't want to talk to the pharmacist, which is perfectly fine. I think we have to provide information for patients when it's accessible to them. So I encourage those patients to go home, take a look at that 6-page printout that comes with it, and then call the pharmacy back with any questions. because the pharmacist is a great resource for providing additional detail that you likely won't be discussing in your provider's office. Now, I would say many providers are very good about providing detailed information to help patients make an informed decision together.
Okay.
In the case that you're not able to get that information and you just want to get a refresher because you're getting a lot of information all the time, the pharmacist is a great resource. And they can go over specifics about your medications, like the dose of your medication, the dosing or frequency, how often you have to take it, how you have to take it. Some medications should be taken on an empty stomach, others with food. And one of the most important parts, I think, that happens behind the scenes with the pharmacy operations that you may not see or acknowledge is that what they're doing is doing complete review of that prescription with all of the other medications that you're taking to make sure that there are no interactions or problems, basically, that would come from you taking the two medications together. So that's one of the most important reviews is the medication profile review that we complete for every prescription that the patient is getting.
So sounds pretty important to, as much as possible, get your medications from one pharmacy.
Absolutely.
So they have that full record of what it is that you're taking. That's good to know. I think you also raised another good point, calling back to speak to the pharmacist if you're rushed, tired, you're ill, and you just need to get your prescription and go home. We often think of calling the pharmacy for a refill. We don't think of calling the pharmacy to speak to the pharmacist and have some further consultation. And maybe we consult Dr. Google to look up information that may or may not be accurate.
And Dr. Google serves a purpose too, so I wouldn't say, technology is so pervasive in our life right now. I would be remiss not to say that people Google. I mean, I think pharmacists and doctors Google things too. But what's different is as healthcare professionals, we're trained to know which sources are more reliable. So if anything, if you like to Google and just want to see, I would still encourage those individuals to call the pharmacy and just confirm, say, hey, I saw this. Is this also, what you would recommend? And the pharmacist can provide their clinical opinion. And we do have access to specific resources that are medication, so specific references that are medication specific. So we can pull kind of into our toolbox and provide more detailed information too. Another piece I wanted to add for that medical record, I think you had brought up, Eva, is over-the-counter medications.
Yes.
And although we don't tend to think of over-the-counter medications as, sometimes people don't even think of them as medications because they're not prescription. There's a number of over-the-counter products now that were prescription products at some point, and they are considered medications. So I'll give you an example like Prilosec or omeprazole. Right? Previously it was a prescription product, now it's an over-the-counter product. Even though you can access it, just know that these medications can be as powerful as prescription products, and we would want to know that you're taking over-the-counter items also to make sure that we're checking those for interactions. A very common one is pain control. So you might be taking over-the-counter ibuprofen or acetaminophen and get prescribed additional pain medication. There's only so much Tylenol or acetaminophen that you should be taking on a daily basis to protect your liver and kind of the ability for your body to clear that medicine. So if you're taking it over the counter and your doctor gives you something else with acetaminophen in it and no one knows that you're taking additional product, what you might get is too much Tylenol essentially and damage your liver. So that's an example of what could happen if we don't take into consideration over-the-counter products.
Okay. What about other over-the-counter products like herbs, extra vitamins, and those sorts of things that can potentially interfere?
Yeah, so what a lot of people don't realize, even though it's right there on the shelf and you can just pick it off the shelf, the over-the-counter products and herbals are not regulated. They're not reviewed by FDA, right? You can't make false claims, but really, if you don't make any sort of claims, you can just put a vitamin on the shelf and sell it. And so there's a couple of things I advise people to look at when they're looking at herbals or over-the-counter. One is the USP, that's a United States Pharmacopoeia review, and so in general those products have been reviewed and have kind of the stamp of approval, so they're not necessarily regulated, but at least reviewed by the USP to contain what they say they contain.
Okay.
And two is what I mentioned before, is making sure that you're telling your provider's office when you go in and they ask you, okay, have your medications changed or what else are you taking? Make sure those herbals are on the list, and likewise with your pharmacy, because herbal products do have interactions as well. And I would say there's a few herbals that we know have for sure interactions, but a lot of herbals just haven't been studied very much. So especially interacting with new products and new medications, there's some theoretical interactions that we can kind of look at to say, hey, based on how this works and what we know about the herbal, maybe this is something that you should expect. But the evidence isn't always the strongest out there for herbal products and interactions. So it's still important for us to kind of report that and take into consideration so we know it's a part of your overall medical and medication record. Same with vitamins. I think there's some really good evidence for like calcium and vitamin D supplementation, for example. Certainly if you're, anemic, iron deficient, you can take iron. But even those should be adjusted sometimes based on your levels. And that's something that your doctor would be drawing perhaps in your lab work and blood work to see, like, are you actually low in calcium or are you actually low in vitamin D?
Okay. You mentioned USP. So, because this is a very confusing thing for people. Is this a good vitamin? Does it have what it says in it? And so it will actually say USP
it
like
will.
on
It will
the
have kind of
bottle
like
or
this
the
black
package?
oblong, and then it says USP review. So there's certain brands that you will find that USP kind of stamp on the label.
Kind of the gold standard to look for. And it's not buying the cheapest one, although it may be the cheapest one.
Right.
But looking for that USP, and we're not wasting our money or taking something that just
At least
really isn't gonna
from a
benefit
consumer
us.
perspective, I think you'd have a little bit more confidence in you're getting what's actually labeled.
Sure. We covered a lot of territory today, just kind of checking through our outline. Anything we didn't talk about that you want to make sure that we mentioned today about medications and the...
If you don't mind, I'd like to mention a little bit about paperwork and labels, because we talked about how you might get a whole pamphlet of paperwork, and that might go in the recycling. So I know we do have some patients who are very vigilant about reading every single potential side effect listed on that paper. And if you do, I think
it can be scary.
Everyone would be scared off of taking medications, myself included. So it's important to know that they provide that information so you can make an informed decision. But very often, the most common side effect from medications are like nausea, vomiting, possibly some constipation or diarrhea, and as your body adjusts to the medication, those should gradually go away. Certainly if they do not, you talk to your provider, talk to your pharmacy, and we should find an alternative. There are certain key rare side effects that your provider and your pharmacist should be counseling you on to be on the watch out for. But as just more of a general statement, please don't be overwhelmed by the long 6-page list of side effects, because yes, every medication will have potential side effects. Some people may take medications and tolerate them perfectly, and some people may get like all 10 of the side effects that are listed. But again, this is where you're the expert on your body, and it's important that you make an informed decision on taking the medication so you know what to look out for. But we certainly don't want to, we respect patient choice, but we don't want patients to be discouraged or scared off of taking a medication that would benefit them just because the side effects look really overwhelming. So remember, we're here as a team to help you manage and help you get the most out of your medications.
Very good. Well, thank you. So good advice. We are the expert on our body. And it's definitely something that we need to pay attention to and take seriously. So,
And we know that medications is a big part of your care plan and taking care of yourself. And so just remember, your pharmacist, pharmacy team is here to help you and support you in getting the most and staying safe while taking medications.
great. Well, thank you, Dr. Ruppel. And this wraps up our story about medications today from Help to Care, sponsored by Family Health Center of Marshfield.